In this video, I'm going to teach the way we need to analyze the case notes of an information letter. So usually information letter is written by a school nurse to parents of school children, or one particular parent of a school child, or to both the parents as well as the children, or to another healthcare professional who is working at a medical setting. Okay, it could be any of these situations. Okay, right, these are the possible situations for a school nurse to write an OET letter. Okay, so in this situation we are going to go ahead with the the structure of the letters. First I will teach you how we can organize the letter. See, the introduction paragraph is going to be the same for all kinds of letter. There is no difference in the introduction paragraph. So we need to clearly state the purpose, isn't it? So for all the remaining four letters, such as discharge letter, referral letter, request letter, and transfer letter, we need to mention the name of the patient in the beginning, right, in the introduction paragraph. But here it's not going to happen. Here it can be a bit different. Here you have to mention, what problem is faced, okay, and then where it occurred. All right. So there's a bit of difference, but the purpose is going to be the same. All right. And after that you need to write down several paragraphs, one after the other. All right, when you go through here, look at this one. They mentioned clearly that you are a school nurse at Two High Hill Primary School, and recently there has been an outbreak of threadworms at the school. Okay, so at the school there has been an outbreak of threadworms. Okay, and so in response to the situation, in order to deal with the situation, or they have got a response, okay, in which you need to write a letter of advice. It's going to be a general letter of advice. So these are some of the keywords which can indicate that you are going to write down an information letter. Okay, if they mention like write a letter to provide advice on blah blah blah, so this is going to be an information letter. Okay, write a letter to provide the guidelines to the parents and children regarding something, that's going to be an information letter as well. So all these things are going to provide the indication of an information letter. Okay, so in response to the situation, you need to write a general letter of advice to the parents outlining common symptoms, identification, occurrence, treatment and medication, and hygiene relating to threadworms. Okay, all right. So usually what do you get? You will get 45 minutes for the whole writing subtest, among which the first 5 minutes will be allowed only for reading the case notes. You won't be able to do anything during this time. You can only read them. That's it. You won't be allowed to mark up. But once the 5 minutes are over, you will be able to get 40 minutes to write down the letter. Okay. So we need to read the case notes below and complete the writing task which follows. That's what we're going to do. Okay. So today's date, this is the date that you have to use in your letter. So you are a school nurse who is working in this particular school. Okay, and there is an outbreak of the threadworms, okay, at the school, and you have to inform the parents and the children, the school children, outlining what are the common symptoms. Okay, if their children face a range of symptoms, you need to ask them to go through and identify that. This is called, in other words, that diagnosis as well. And then the occurrence means how it occurs, how it produces. Okay, all right, how it leads to the problems. Okay, and then the treatment. Okay, what kinds of things we can do to remedy the situation, to remedy these worms. Okay, and then there will be medications plus the hygiene relating to the threadworms as well. So we need to include in our letter, we need to include all these kinds of information. Is that clear with everyone? So you need to write them down one by one. That's it. Symptoms, one paragraph; identification, one paragraph; occurrence, one paragraph; treatment, one paragraph; and medication and hygiene. We can put these three things together because hygiene, medication, and treatment are going to be almost related to each other anyway. If that's the case, if you have got only less relevant case notes under medication and hygiene, you can put them together under the treatment paragraph. Okay, so this is how we are going to organize. In other words, the structure of an information letter is the same as that of the reading part A question paper. Okay, when you go to the text, you will get a range of things, isn't it? When in part A of the reading, you will get the overview of the disease in the beginning, and then they will mention the causes, the symptoms, and then the causes, and then the identification, they will mention all those things, one by one. Okay. So it is the same way we are going to write down the letter as well. Look at this one. These are the signs and symptoms. So after the introduction paragraph, we have to write down this signs and symptoms. They mention these things, like intense itchy feeling around the anus, restless sleep, teeth grinding while asleep, irritability, loss of appetite, occasionally slight stomach pain associated with the gastrointestinal upsets can cause urinary tract infections as well. Please note that many people with the threadworms show no symptoms also. That is also going to be done. So you need to think how we are going to link these sentences together. Okay, when you look at it, these are the general symptoms, isn't it? These are the general symptoms until now. These are the general symptoms, and this is the occasional symptom. Okay, and this is also an occasional symptoms because they used can cause. Okay, can cause means it may occur. That's what they're saying. And then this is another one which is going to contradict with this one. However, some people do not demonstrate any symptoms at all. Okay, that's going to be the next sentence. So how do we need to organize this particular paragraph which illustrates the signs and symptoms? You can start by writing down regarding symptoms, comma, or you can just start writing down, well, the common symptoms include. I think that's going to be much better. The common symptoms include, and then you'll write down all these things, one by one, one after the other, using a comma after each of them. All right, and it's better to use at least some kinds of synonyms. For example, instead of using irritability, you can say irritation. Loss of appetite could be something else, so you can use those kinds of things. Okay, right. So occasionally could be sometimes, it can go in the second sentence. Okay, you can say sometimes, the symptoms also include, or the signs also include, mild stomach ache. Okay, mild stomach ache related to gastrointestinal upsets. Okay, gastrointestinal disturbances or so on, as well as you can write down this one, urinary tract infection. And then in the third sentence, you can write down like this. However, many people do not demonstrate these kinds of symptoms. Okay, so you can also write that down. So this is going to be the first paragraph after the introduction paragraph. Is that clear with everyone? So we'll go through them one by one in the same order. Okay, now what would be the identification? This is how you need to identify, how you need to diagnose, or what would be the occurrence, how they are going to occur and so on. Okay, so these two things can go together. Otherwise, you can write down maybe identification separately and then the occurrence separately. That's up to you, whatever you want. Okay, occurrence should come in the next line. I think, yeah, by mistake I have put them together. Okay, right. So resemble fine pieces of cotton thread up to 1.5 centimeter long. So how do we identify these worms? Okay, these worms look like the fine pieces, the small pieces of cotton. They are going to be just like the cotton pieces. Okay, and they are going to be up to 1.5 centimeter long, up to. Okay, so that's a maximum length, with the maximum length of. So you can write like that. You need to anyway rephrase the words from the case note. So you can't write down the same words. That's not good. And where do they appear? They appear on the outside surfaces of faces, and then active during the night. So you can write down all these things. Okay, you can go ahead with these three things together in one paragraph, or if you want, you can also add the occurrence as well, in the same paragraph. Okay, it's up to you. But I believe this is going to be a bit longer, so it's better to write this one down in a separate paragraph. Okay, okay, in the occurrence, that's going to be the next paragraph. We can say, they usually, okay, these threadworms are usually present in warm weather. Okay, in spite of good hygiene standards, or in spite of excellent hygienic standards. You can use some kinds of synonyms. Okay, and then you can also encourage that, these things as well, common in warm weather. And it is, you can mention like this, uh, crowded living conditions promote the spread of the worms between family members. Okay, for example, all right. So for example, if they live in a home, usually it can be transmitted from one person to another. So it is a transmissible disease. So you can highlight this. Okay, these worms can spread, can transmit from one person to another within a family. Okay, and in a crowded area and in a congested area. So you can mention these things. And who are mostly vulnerable, who are going to be affected more than any others? It is the children only that are aged 5 to 14. Adults can be infected by eggs spread around in home or school environment. So adults can also be infected. It doesn't mean that adults will be escaped from this worms. They are also going to be affected, and they are usually affected by the eggs spread around in home or the school environment. Okay, but mostly the people who are aged 5 to 14 are going to be affected. Okay, outbreaks noted at school and daycares. So so usually these outbreaks are noted at schools and daycares. They have recently found out, and that's why they are sending the letter to every parent and child. Okay, so that they can take precautions in order to avoid those situations, or if they have got something already, they can also manage it, they can also treat it. Okay, so what we are going to do is initially the overview, and then the signs and symptoms, and then the identification. Or you can provide this can be mentioned along with the signs and symptoms as well. That is also fine. You can also write this one down before. Okay, it's up to you. Or you can go ahead with the signs and symptoms first, and then identification, and then occurrence. Okay, that is also good enough. Does anyone have any questions so far? Is that clear with everyone? Usha, Niranjani, is it all clear with everyone?
Yes, sir.
So Jinsi, Lissy, so the information letter, as I previously mentioned, it's going to be the replication of the part A reading text. That's it. It's the same thing that you're going to do here, but you're going to write down in paragraphs. That's it.
Sir,
Yes.
The addressee will be the parents and the children.
Parents and children, yeah. When we go to the writing task, we'll be able to get to know to whom we are going to write on, and it just only the parents and children. And then underneath that, you can mention the school, the name of the school, Two High Hill Primary School. That's it.
Thank you, sir.
Yes. Sandhya, do you have any questions so far?
No, sir.
Okay, perfect. All right. Neetu, do you have any questions?
No, sir.
Okay. So when you go to the identification and occurrence, once you finish this, you can go for the treatment. So usually, all these things, okay, do not have the complete sentences. They will only use the case notes form, and you need to be very careful, what you're going to do. And look at this one, hygiene. Hygiene itself is really big, isn't it? It's really big. It's so big, which means hygiene can go in a separate paragraph. All right. And then this treatment is going to be, in one paragraph as well. And we just need to see how we are going to merge them together so that we can reduce the number of words. Firstly, we need to find out, which ones are relevant and which ones are irrelevant. And usually in information letters, all the case notes are going to be relevant. But the way we need to reduce the words is, for example, instead of writing down non-suitable, you can use, inappropriate or unsuitable. So you can make these two words into one word only. Is that clear with everyone? Right. So consult the doctor or pharmacist first. Okay, see this one. This is the treatment. This is what they use. Actually, it's available from the pharmacist. However, consultation is required first. Okay. So you gotta use this. Okay, you gotta use that. And yeah, so and then unsuitable for pregnant women and children under 2. So this is a precaution. They should not use it. And it is also going to work only these medications are going to work only on the adult worms, okay, present in the intestine when medicine taken. That's it. All right. For the other ones, for the eggs and some other, worms, the young ones, they are not going to have any impact on them. Okay. And see this one, treat whole family at the same time to minimize the risk of reinfestation. Okay. Otherwise, one fellow can be treated, and then the other fellow is going to get the same thing, and then the disease will be spread from one person to another. So one person gets treated, and then it goes on to the second person, and then it goes on to the third person, and so on. So it is really essential that all the family members are going to be treated simultaneously. So you can use the words like this. Okay, treating all the family members simultaneously is critical to minimize to reduce the risk of and blah blah blah. Okay, and when you look at this one, see this one, at same time, that is wrong. Why? Because it's going to be at the same time. Same always require the article called the. And once they go for the treatment, after that everyone again after 2 weeks needs to go for the treatment once again if they suspect. Okay, so after treatment they need to, so which means they need to get monitored as well. So monitoring is also required after 2 weeks. So firstly they get the treatment, and then they will have a review in 2 weeks, okay, to see if the treatment is again required or not. Is that clear with everyone? So this is what you're going to do. And hygiene is going to be a separate paragraph because we've got a lot of things here. Okay. Firstly, morning shower bath to remove eggs laid during night. Okay, that's really important. And then ensure everyone always uses own towel and face cloth. Okay. And the third one is during treatment, change night clothes or underwear of infected person daily. Vacuum carpets often, especially bedrooms, to remove dust. Change bed sheets frequently, especially first 7 to 10 days after start of treatment. Keep nails of infected people short to reduce chance of eggs being being stored there. Wash hands thoroughly after using bathroom and before meals. And then keep toilet and bathroom area clean. Okay, how we are going to write them down? If you write all these things, it's going to be definitely more than 220 words. 100%, yes. But how do we do it? What we can do? Okay, see this one. It's washing the hands, thoroughly after using bathroom and before meals. You can just mention hand sanitization. Hand sanitization, that's fine. That is absolutely fine. Or sanitizing hands is critical. That is fine. Okay, we can add maybe two things together in one sentence, so that we will use only one set of verbs for both of them, instead of writing down separate verbs for them or using the connecting phrases. And we don't need to say shower or bath. We can just mention shower. That's okay. One of them is fine. You don't need to use separately both of them. Okay. Right. And ensure everyone also always uses towel and okay. So morning shower using the own towel, and face cloth. Okay. See this one. So this one has got connection with this one, isn't it? So you can put them together. You don't need to write ensure everyone always uses. This is wrong. This is not needed. So we can mention that. Otherwise, we can mention like ensure everyone takes the shower, okay, using their own towel in the morning. Okay, something like that. Yeah. So you can mention that instead of writing down these two things separately, we can just club them together in one sentence itself. Is this clear with everyone?
Yes.
Yes. And then this one as well. See, what you can mention is, okay, let's go through this one. Ensuring everyone uses their own clothes after shower, and changing of the infected person's night clothes, or you can use maybe clothes, okay, night clothes, every day or every night, okay, every night is important, okay, are important. We can, because we are using two verb plus ing, so we can use changing as well as ensuring. So that's really good. Yeah, you can use are vital. So we are going to add 1, 2 and 3, these 3 bullet points together in one sentence itself. So we can write like this, okay, ensuring everyone uses, or ensuring everyone has their own towels after shower, yeah, or ensuring um, everyone has their individual towel or unfaced clothes after shower, and modifying or changing the night clothes of the infected people are critical. So you can mention those things, those 2 things, okay. And then vacuum cleaning, vacuum the carpets and especially bedrooms to remove the dust. It is actually vacuuming bedrooms, that's it, finished. Vacuuming bedrooms, okay, or vacuuming carpets in bedrooms, okay, or you can say regular vacuuming, in bedrooms, okay. Regular vacuuming in bedrooms is critical. And also these ones, changing bed sheets frequently, after the start of the treatment. So you can also include these 2 things, okay. For example, vacuum cleaning, or you can say vacuuming of carpets, okay, in bedrooms, and changing bed sheets frequently in the first week following the treatment is important, okay. You can write that down. And then these ones, keep nails of infected people short to reduce chances of eggs being stored there, okay. So you can say, in addition, you can also mention this, keeping short nails, okay, keeping short nails is critical to prevent, okay, it's critical to prevent the restoration of eggs or storage of eggs, okay. And hand sanitation. So you can mention the remaining 2 things together as well, okay. Right, or look at this one, this bathrooms, toilet, you can put this one maybe here as well, vacuuming the bedrooms and keeping the toilets and bathroom clean are critical. You can also use this one with this one as well. So you can play with, you can try to see how you can link them together, and then you can write that down, okay. And let's go through the writing task. See, using the information provided, write a letter addressed to parents of students at Two Hay Hill Primary School. Okay, that is what they are asking us to do. So we need to write down this parents on the top, and then you can use Two High Hill Primary School. That's it. So you need to provide the information on the threadworm and its treatment. So how it's going to be treated. So information on means it includes everything, all these things, signs and symptoms, identification, how we need to diagnose, how we need to treat, and what are the precautions. You also need to mention unsuitable for pregnant women. Why it is necessary? Because some parents might have been planning to give birth to children, maybe, okay, during this time. So we need to mention these things, okay. So almost every information is critical, so you got to write that down. But before they take Vermax or this one comparative, consultation is required, okay, from the pharmacist or doctors. All right, so you can add this one, okay. As it is not suitable for pregnant women or children under 2, children aged 2, or you can say infants, isn't it? Infants are okay, or maybe toddlers, okay. I think 2 means it's toddlers, I believe. Yeah, toddlers. So you can write down toddlers rather than writing down 3 words like children under 2. You can use maybe toddlers. That's it, okay. So inappropriate, I mean inappropriate for pregnant women, and
Or it is not recommended.
yeah, it's not recommended. That's also good. Yes, but it is actually prohibited. It's not good for them at all. So it's prohibited. Yeah, you can mention that. But yeah, it's okay. I mean, you can write, inappropriate, okay, or it should not be used by them. Okay, so that's what you're going to do. And this one as well. So the first point, and then the second point, and then the third point. We can write down these three things together. Okay, for example, so consultation with the doctor or a pharmacist is required before, before commencing Vermox or Compondrin 1. However, or you can say which only works on adult worms, the worms which are grown up, present in the intestine. Okay, that's it. And you don't need to mention when medication taken because it's already mentioned over there. So we can remove these words. Okay. So you can say, consultation with the doctor or pharmacist is required before the treatment, before commencing Vermox and Compondrin, which work only on adult worms present in intestine, or which work only on adult worms in the intestine. That's it. You don't need to even mention intestine. That's fine. It's okay. Okay, all right. You see, that's how we are going to link them together. Okay, these are the ways, we have to organize, the ideas. We need to ensure that we link, at least two things together and we write only one verb. Okay, it can reduce the number of words. Does anyone have any questions so far?